I'm Bruce Roth. I'm a professor of medicine and urology here at the Vanderbilt Ingram Cancer Center. I had the genitourinary research program here at the Vanderbilt Ingram Cancer Center and have been doing testicular cancer research for 25 years. Testicular cancer is a malignancy of actually we call the germinal epithelium, the reproductive cells within the testicle. It's important because it's a highly curable malignancy, particularly if caught early, and is a disease of relatively young individuals who, if are cured, have a long and productive life after successful therapy. So although it's a relatively rare malignancy with about 8,000 cases in North America this year, it's the most common malignancy in the 15 to 30-year-old male group, and therefore extremely important to catch at this age. I think that there are several things that conspire against the early detection. First is that the group of individuals at risk, namely 15 to 30-year-old males, frequently think that they're immune from health problems, may not be seeing a physician on a regular basis, and then secondly may be reluctant or embarrassed to talk about pain or a change in physical examination in this area, and will frequently have people tell us that they had a mass in the testicle for 12 to 18 months before presenting, and finally it was because of pain that brought them to the emergency room, but they knew that something was a problem earlier on. So I think if we can get people to do self-exams, realize that they're at risk for the disease, and that it's highly curable if caught early, then we can get away from many of those preconceived notions of embarrassment. Well, I think the first is that somehow it's caused by trauma, either acute trauma or chronic trauma, riding bikes, people who do a lot of sitting in positions, truck drivers, things like that. Those are all myths, and in fact there are no known causative factors for the development of testicular cancer. There are some associated factors, namely the failure of testicles to normally descend at the time of puberty. Although this is not a causative event, it's just a marker for a group of individuals who may be at an increased risk for subsequently developing testicular cancer. Any mass felt in the testicle on self-examination or pain in the area that was not related to recent trauma or that persists for some period of time beyond that trauma, you should present to a primary care physician if there's any question about whether there's something present in the testicle. A subsequent ultrasound of the testicle is done, and immediate referral to a urologist for subsequent examination as well as blood work. Many people will report having either some pain or heaviness in a testicle that evolves over some period of time. Some people will report having had trauma to a testicle either during sporting events or whatever, and associate a mass or tenderness with that, but in fact this did not cause a malignancy, it just called attention to them doing an examination for the first time in a long period of time. Well, I think pretty clearly once you have high-profile individuals that have come out and told their stories, then it certainly seems like it's okay for you to have testicular cancer as well. And when you see people who are cured with early intervention, even with far advanced disease, then I think it's an important health step to take and take responsibility for your own well-being by looking at the thing that you're most at risk for in terms of malignancies and addressing it with self-examination. Talking about it is clearly something that needs to be done. The patients that we have who are younger take every advantage to go out and talk to other groups about awareness, about doing self-examinations, and I think that probably primary care physicians caring for adolescents or young adults should be made aware of this as well.